Dale, and good afternoon, everyone. I am Dale West. I am the team lead for RPIW 31, falling back there a little bit. That was done in the mental health inpatient unit. We will be speaking to a task time of 20 minutes. There's our team. Yay, team. Certainly my great privilege to have you work with these really, really great folks. Good folks all. Our project, I will direct you down to our theme here. To reduce defects in the mental health inpatient plan of care as a foundation for successful discharge. We started off to look at repeats, readmissions, 30-day readmissions, and very quickly we realized that it had to be centered on care, the care being delivered. Our value stream, while we did look at a longer process, what we really focused on was two important areas. One that was complementary to the process that happened at the same time, a package of care being assembled with a pre-assembly even before that, and then our patient assessment. So our lead time, our total time, 1 hour, 36 minutes and 15 seconds, value added over an hour, value added percentage 68%. Our target progress report, I think probably the most important number you'll see here, and one that hit us right away, 94% defect rate in the actual care plans that were in part of the overall package. And by defect, that they either weren't complete, there was something wrong with them. It indicated to us right away, and everyone we talked to, that they weren't being used. Why weren't they being used? Because they weren't useful and meaningful. Again, just more of a target sheet. We had a takt time of 660 minutes or 11 hours. At this point, I'm going to turn you over to Randy.
Yes, ma'am. As you all know, I'm Randy Watt, recreation therapist for mental health inpatient. I just want to say I'm so glad it's Friday. The running joke was we were going to do a mock admission and I wouldn't be able to leave. So I'm glad it's Friday. The one thing that we focused on was communication pieces in terms of the communication board. As you can see, it's messy, it's scattered, it had lots of information, duplicate information at different areas across behind the nursing unit desk. There's the another piece of doors were utilized as well for communications, for memos. And then so we decided to focus on that. So we did like a clipboard system where it was 6 clipboards, and there's a communication binder that addresses the clipboards that Chris is going to talk about, and it's a grab-and-go clipboards for anything that they need, so the contact information. We cleaned up the doors, but now these 2 doors are going to be used for, they had dry erase paint. This is going to be a patient board talking about their behavioral plans, talk about SRT, recreation things for communication. If it gets missed, it'll be on that board, and the other board will be used for morale, like a staff morale board, positive quotes, so-and-so's getting married, kind of things like that. So the whole, it was 119 square feet, I believe, and we reduced it down to 76 square feet, and we removed 37 outdated, inappropriate memos and messages that didn't need to be there. So our MS training checklist is Adam and Trudy has already been kind of trained on the communication book piece, and all staff, all employees will be trained by March 13th within the communication piece that Chris is going to now talk about.
Okay, so my name is Chris Archibald. I'm one of the clinical supervisors over at Addiction Services Outpatient. So one of the problems that we focused on was really the communication binder or book that they had before. I don't have the old one here, but there was stuff missing in it. There was pages falling out. Stuff wasn't dated, signed. You didn't know if where it came from, right? So we basically took a look at that, talked to Adam and Trudy, and we created a new communication binder. It's got 5 areas. One is a booklet that helps communicate from management and an educator down to staff. Another booklet that's from staff to staff. And then there's also a general memo section and nurse educator section. And so it really just organized the process for the unit, and it also communicates back and forth between that communication board that Randy talked about and the book. So standard work that came out of that was 3 pieces. One for the communication binder to organize it. The other one, standard work, was really about the communication process, so from management to staff and how that's going to work. And now it can be dated, initialed, and it can also be audited in regards to are the staff actually reading and signing and up to date on that information. And then last but not least, another piece of standard work in relation to the communication binder. So it allows the archiving, which is a huge piece. So archiving that communication binder every 3rd Monday of the month for the unit clerk. Oh, sorry again. This was huge. So basically the work standard books, what we did in regards not just to those work standards, we went and collected all the work standards on the unit that was already in place and captured them in one area. So they're all in one area, and it just improves that whole communication process.
Why don't you open it up? It's so
There you go, Vanna.
So, yes, so overall I think 9 standard pieces of work are new, but we have a number of other ones in here, very organized and very structured.
Hi, I'm Amy Phillips. I'm on my last day of my 3rd and final practicum with Randy in recreation therapy. So I was a part of the team. We looked at a different process for putting our packages together. So when we started, it was very cluttered, disorganized. There's information kind of all in different rooms. So this was the pre-picture of our filing area, just kind of cluttered in disarray. So then we did some spaghetti diagrams, and as you can see, the route was back and forth, back and forth. So what we were actually able to do with that by putting everything in one area was we decreased from 53 feet to 0. It's all done in one space now. So our MS training checklist, the full-time, this is for the CCA, so we had the role clarification that it will be the CCAs that put together these packages. The permanent staff is a date of March 13th, the casual March 27th on those. And that was pretty much it, and over to Heather.
I'm Heather, I'm the unit clerk at the mental health department. What I'm going to explain what we worked on is the chart prep room, which is what we're calling this now. The problem is that the room was cluttered and disorganized. We had too many copies of too many forms in too many different locations, so we centralized everything into this room. We've outlined a shadow box in blue, which will tell the carries what goes in the packages in what order. And we've got a demo package on the side of the wall that says draft there. That shows them step-by-step what's in the package. And then we've got a standard work form on the bottom which tells them the role of what to do. So we started with these 2 packages. We started with this one here and we went to this here. So we started with 67 forms and we've gotten it all the way down to 40 forms. Thank you.
Hello, my name is Donna Kaminsky. I'm a registered psychiatric nurse, and I work as the clinical nurse educator in mental health inpatients. We had collected an idea sheet for improvement to our nursing assessment and charting system. To expand on, the purpose was to reduce defects in the mental health inpatient plan of care as a foundation. For successful discharge, our team felt our nursing database needed to be restructured. By using a template of the provincial assessment tool for mental health and addictions, we were able to incorporate our own mandatory forms with a new improved assessment into one complete, concise document. Along with this new assessment form, an interview guide was developed to aid the assessment. Our charting system had been very subjective to how and what areas were being assessed. Development of a 12-hour flow sheet was done to have a consistent physical, mental, emotional, and behavioral assessment on days and night shift. A guide was also developed for this form to assist us in the process. And now I'll hand over to my team member and we'll continue on with our report.
Hello, my name is Stephanie Greedy. I'm the program nurse on the mental health unit, which means I do client education and therapeutic interventions. So I'm going to talk a little bit about, just expand a bit on Donna's work, about the database and the care plan, or yeah, the database and the care plan. So we did have a lot of ideas, and we knew we needed to change it. So once we changed it, we had to come up with some work standards. So we came up with the work standard for the nursing flow sheet, which outlines what the nurse is supposed to do every 12 hours. They would be doing a new sheet. And then the other work standard is on database usage. So that just outlines the progress of using the database for the nurses as well. We started training on all of those 2 sheets. There's also 2 others on there that some of my other cohorts there will discuss. But with the database and the 24-hour course assessment, we'll have that done by March 13th. Now the other thing that we noticed, improving the timings wasn't the goal, but we did notice that when we were doing the assessments, the timings went from 51 minutes for just the assessment, the database portion, and it was reduced to 42 minutes. I will pass it off to Alexis.
Hi, my name is Alexis Poulin. I am the residential coordinator with Mental Health Outpatient Department. And so what we looked at was revising the current admissions package to be more user-friendly. So we were effectively able to reduce the number of forms from 35 to 19 on the admission package. So in addition to that, we reorganized the order of the forms to be easily accessed by those who need them. So the continuing care aides and the nursing staff. So there was work standards and a template created to ensure ease of use. So what was just up there was the new order that the flow goes. So we created some work standards around that. So the first work standard was the printing of the patient labels, and then the second work standard so this is the printing of the labels, and the other work standard was around packaging the new admission file. So in addition to that, we created a few revised forms. So the vital signs record and the inpatient personal belongings list and clothing list. So we just updated these and made them more user-friendly for the patients. So in addition to that, we then created a template, color-coded template, so that this will go in for the beginning of each client chart, and will outline in color the way that it's organized. So under each heading is identified what's to be in that particular compartment. So if someone needs to look at it, they can just look at the front and find exactly what they're looking for. For example, nursing notes, they would flip to the section that it is. So we were able to do multi-skills training with the staff, and that was captured on the previous presenter. So from there, I'll pass it on to Abby, who will talk about our care plan.
Okay, here's our idea summary sheet. You'll have to excuse me because I have no voice. My name is Abby Karblick, and I'm an RPN in the inpatient unit. I'm talking in regards to the improvements we made to our care planning process. The past system was outdated, ineffective, and as I said earlier, 94% incomplete. It was too general and didn't take into account specific patient needs. The new care plans we developed are more user-friendly, goal-oriented, and most importantly, they're patient-centered. Our goal is to improve treatment outcomes and provide ongoing assessment to determine discharge readiness. And that's just an example. And then we created a work standard for filling them out. And then just a list of all the training. And we hope to have all the permanent and casual staff trained by March 31st is our target goal.
Hi everybody, I'm Frank, and I was sub-team lead on RPIW number 31. We did a waste walk, one of our first meetings together, and identified some of the pre-event waste, and you can see it up here on the waste wheel. And this afternoon, or just before lunch, did we get lunch? This is what it looks like now. So this team did a remarkable, amazing job. It showed a lot of flexibility and did a lot of waste reduction in the area of mental health inpatients. So here's our target progress sheet, and it was mentioned before that the defect rate was 94%. So when we got into the care plans, we looked at were they complete, and if they were the date actually right? And most of the time, they were very consistently incomplete, or they hadn't been updated for sometimes quite a period of time. So we had a defect rate in the care plans of 94%. So we thought, what's the plan of care in order to help discharge along the way? What interventions? How are those interventions being communicated? So we got going with a big help to everybody down in mental health to that. So we had the pleasure of doing some post assessments with the new database being implemented. There was 3 discharges in about 3 admissions in about the last 30 hours. When we went through the databases, then all the databases are complete in their entirety, including dates, check marks, initials. So we're really, really impressed with the amount of buy-in, and people were really enthusiastic. So that's a big gain. And also the lead time, we were able to reduce that a little bit. That wasn't a huge thing. We felt that the parts traveled, and a lot of the pre-work prior to that was something that seemed to be multi different people. Like there wasn't a lot of role clarity doing different things, all depending on who was available. So that part does not travel at all. And so those 2 things, I think, will be able to free up a lot of valuable time for staff and provide some clear roles as well. So so that you can see the productivity gain and the setup times are we were quite happy. And again, the cycle time did go down, but we weren't all that focused on that. So we did leave some newspaper items. Just like any other big 24/7 operation, communication is unbelievably key. We spent all kinds of time passing things along, and we went back to talk to the same people. Sometimes we didn't even remember what we told them the first time. So it's really important that the big newspaper item is going to be the multi-skills checklist, and we're going to audit those things along as we go along to make sure that the folks that need to know the information know the information. When they show up tonight, there's a brand new crew coming on Friday night shift, so we're hoping that they can find the things that they need and they understand the teaching sheets of the new communication tools we left behind. So, and a workshop summary is communication. Again, it's more structured with the good work that we're on the communication books and the expectations around that. The new database and assessment process, centralized package creation area and an area that takes the steps right down to 0. And it's really all about the client, and they really focused on that, coming up with more multidisciplinary client-focused approaches in the care plan. So we've got to thank a lot of people. I guess our implementation plan, again, I won't get into it. There are the pieces of work standards. There's 9 of them, and Trudy and Adam, along with Deb and Donna and their educators, and everybody will be tasked with continuing on with the communication and education regarding that. Thank you very much to Brett and to everybody in your team and all the ward staff down there, and to pharmacy and lab and maintenance, and to the Dubé Center. All the levels, level 4, 5, and 6, because we stole shamelessly from your 12-hour shift report to make it more mental health friendly, so thank you. Colleen, where are you? Thank you very much. I'm glad you're still going to talk to me at the end of this week. And Deb, of course, from JBA. Thank you guys very much, and to a very wonderful, great team. I really appreciate it, Dale, everybody else. And thanks for listening.